Hi guys, welcome to our lecture on cultural awareness. My name is Clark Imus and I'll be facilitating your video lecture today. Let's go ahead and dive in. We know that the United States of America is a country of immigrants. We are a melting pot full of many rich cultures, religions, personal experiences, stories, things that make our country unique. With that being said, we also have to recognize that our students are going to have different backgrounds, ethnicities, cultures, beliefs, values, and it's our job to ensure that the environment that we put forth to our student, the content that we put forth to our student, the example we set for our student embodies the importance of understanding cultural awareness, not only as a provider, but as an educator within the classroom. Many individuals embrace their culture and do not wish to surrender it, and I don't blame them. It results in cultural plagiarism, where they, in essence, give up and just assimilate. And that loses such rich value in history and contributions to the learning environment that can enrich the experiences for all individuals present. We know that nation profits from contributions that different groups make to society. So as we look at having more and more aspects of contributions from others, that it does help aid in society's development and growth. Now, if we think about cultural awareness, specifically diversity in the United States, there's a ton. There's at least 100 and over 100 ethnic groups and over 500 Indian groups. This makes it very challenging to know all of the things that are going on with culture, but when we deploy simple, basic approaches, that we can make sure that we're being very inclusive, that we're recognizing the importance of diversity and recognizing the importance of inclusion. Now, it's difficult to set aside strongly held values or beliefs from students or from yourself, but it's very important that we not have bias. And oftentimes people go, well, I'm not racist, I'm not biased, I despise when someone says, well, I hate everybody equally. That's a load of crap. But realistically, everyone is going to have some type of bias. We call it implicit bias. Bias you may not even know that you have. Sometimes bias is very notable, and sometimes it's very subtle. A bias could be a lack of resources for someone who speaks a unique language in your area. It could be a situation where an individual may withhold treatment or withhold additional assistance to a student, not knowing that it's a cultural bias, but because it's just something that they naturally do, and maybe their values and morals don't identify it as a concern as much as it would for someone in that culture. Now, there is a number of different aspects when we think about diversity. One of them is being age, right? We got to understand age. The era in which one grows up puts a significant imprint on their views and values and expectations. Their upbringing has an impact. Now, life experience has an impact on that as well too. It's really important that we recognize that age really should never be a form of discrimination, number one. And number two, the age at which a young person is considered to be an adult is when they're finally actually able to make decisions, right? And that's not necessarily just 18 years of age, you're an adult, right? There are cultural aspects that play into that, where maybe it is at the age of 16 that you are now considered to be an adult. Or maybe if there's other aspects or religious events that then say now you are considered to be an adult. We have to recognize that culture impacts our dynamics within education and our dynamics within the learning environment. Now, gender is another one. We got to recognize that gender is something that is seen through a new lens today, and rightfully so. We've got to recognize that there are some gender roles, but we want to avoid those stereotypes. EMS has generally always been a white male-dominated industry, right? You go to an instructor conference and you look around the room and it's all generally white bald men. um, or maybe some of us haven't lost our hair yet, but that's pretty common. We want to try to avoid those aspects, right? We want to diversify our classrooms. We want to incorporate new cultures and beliefs and anything we can do to enrich the environment, because we know when someone calls 911, it's not just people of a certain sex or people of a certain age that call 911, it's anybody, right? We know that men and women will communicate differently, but really it's more important not to treat to talk to a male versus differently than you would a female. That can be sexist in itself. We want to avoid that, right? Where it says women interact to form relationships and men establish a hierarchy of order. Yes, to a certain extent, that is true, but that's not necessarily completely accurate, one versus the other. Women can easily have a hierarchy and control and have order, and men can easily want to have interactions to form better relationships. We can't recognize that, yes, there's rules, but that's changing, and so I'll leave it at that. We also have to understand ethnicity, and ethnic backgrounds include things like their native language, cultural norms, holidays, observations, right? Not everybody celebrates Christmas, so you can't necessarily go and say you're going to have a Christmas party. You got to try something different, maybe. Sounds like a discussion you're going to get into. Same thing goes with social affiliations, with healthcare, preferences. All of that makes a big difference. So we have to understand and be accepting of our differences, because it's going to enrich us and it's going to enrich the environment in which we're instructing. Now, while some Americans are comfortable with self-reliance and independence, that's not the case for all cultures. Independence with relatives and friends, we may see that where it's only with family or extended family, which are considered to be very important. One may not be comfortable speaking in a group that's not family. Oftentimes, that may be perceived as being aggressive or may even bring shame and embarrassment to their family. That's eye contact with certain cultures. Maybe you have a female, but only the male can speak, right? Those hierarchies, they do exist in multiple cultures in the United States. Know your area that you're working in, know what you're faced with, and embrace that culture. Some ethnic cultures are non-aggressive and non-confrontational, right? Some may not be comfortable making eye contact, as I mentioned, and many cultures address persons of authority formally by until receiving permission, right? So if I need to talk to the patient, who may be one individual, but I have another individual who is of a higher on the hierarchy or is considered to be an authority figure, then I may have to get their permission for them to speak, right? Or they may have to get permission from that authority to speak, which is unique, but nonetheless, it's part of their culture and it's something that we have to adjust to, that we need to make sure that we're not putting our culture and our bias and our belief system onto others. We also have to recognize gestures, speech patterns, because they do not all have universal meanings, right? Smiling or nodding, shaking your head may or may not make sure someone truly understands what's going on, right? Oftentimes, if someone's kind of snickering, like a student's laughing in the background, sometimes that could be a sign of embarrassment or confusion. And even things when you're trying to get information, right? Yes may indicate I heard you speak versus I agree or I understand. Those are different aspects, right? And different areas in the way that they respond. It could be based on a cultural aspect, which could impact some of the way in which you communicate. Again, you need to be aware of that. We also want to make sure we recognize some ethnic groups value silence. I think as I've had kids, I do definitely value silence better or more than I have. I'm sure some of you can relate to that. But it's a sign of respect and attentiveness when you're quiet and you're focused and you're giving someone your time. Eye contact is one of the ways I really try hard to make sure that when I'm listening to someone, I give them good eye contact. Oftentimes, humor and gestures are offensive, right? The jokes that you think that you heard somebody say that got some laughs may not be appropriate in every situation. A great joke your instructor told you in class that made everybody laugh may get you fired if you tell it today. You got to recognize who you're in front of, because some of those things really are going to make a difference. We also want to make sure we understand physical ability. 43 million Americans suffer from a physical disability. We oftentimes are going to find where they feel like they're being ignored because of a physical ability. We need to make sure that we're making reasonable accommodations for them to get their education. It's very dangerous to tell someone you don't have the physical capabilities to be able to learn to do this. That doesn't mean that they're going to have to be able to perform it. It's the ability to give them, it's the opportunity that you're going to give them to learn, and that the opportunity is going to be there, and that you'll make accommodations reasonably to help them complete that learning process. And again, it gauges the level the individual desires or needs your assistance before you're ever offering assistance either. You don't want to offer stuff up, assume someone needs this, like, oh, do you need extra time on your test? Do you need to read? Don't assume those things. Ask them if they have maybe an IEP, an individualized education plan, or they've got some type of 504 or documented disability on file. Those are the key things that we're looking for. We also know when it comes to sexual orientation, we've gotten a lot better in EMS about dealing with this, and I think globally in general. But non-heterosexuals are often assumed to be affected with HIV or AIDS. Again, that's in your objectives. That's not the case any longer, I don't think. I think that we've become a little bit more progressive over the years. I know that there are a lot of providers in EMS that are non-heterosexual, and they're excellent at what they do. Patients may fear that. Sometimes folks who may just be uninformed may fear that. We have to recognize that really is not always the case. When it comes to race, some races are really more stereotyped than others, and it really just depends on like what's going on. The Arabic community, 9/11, I mean, that was a huge issue, the amount of discrimination that they faced. If you look at some of the aspects involving criminal justice, police involvement in the African American community, you're looking at situations right now with folks who are Hispanic, with the border issues that we see. You're seeing issues, I mean, it goes on and on and on, regardless of race. We can't do that. We need EMS to be diversified. We need more EMS providers. We should not be excluding anyone based on their religion, race, color, creed, sexual orientation, belief, whatever it is. I don't care. At the end of the day, every human bleeds red, and everyone is going to need a competent paramedic to help them in that situation if in case they need to contact EMS. Religion's another one, right? Sometimes students can't make it to class because of a religion assignment. For example, Seventh-day Adventists, Jewish, they don't do anything. They observe the Sabbath on Saturdays. And during that time, that's something if you're having a Saturday class, you really can't discriminate against them because they're religious. You're going to have to try to make some accommodations. You got to know a little bit about that. Muslims are going to pray 5 times a day, each day, right? They may not be available to do things when they're required to pray. Those are things to think of. Other aspects I think of include Jewish, not Jewish. Well, we can talk about that. There is a lot of anti-Semitism that's out there right now, specifically for Jewish people, having a lot to do with what's going on currently in Israel. That's not okay. And if you're seeing those things in your classroom, boy, you got to stop that. There are belief systems that can come in the door, and there are some that can't. That's an example of one that absolutely cannot. Christ Scientists and Jehovah's Witnesses, no blood products, no blood. Do you expose your students to that? Do you do a scenario where that's the case? Because not every student is going to have that same belief, and they may respond differently in those circumstances than you would normally expect. I say so because we have a case that involves a Christ Scientist or a Christian Scientist, and it definitely has evoked a lot of emotion from students who do not have that belief system. Mormons, they got to fast for 24 hours once a month. And there are other religious mandates that may be imposed for specific things like dress code that are just going to conflict with what your field or dress code may be for class or for clinical settings. You got to understand that regardless of those things, we want to make sure that the environment is inclusive. And sometimes it's going to take some extra time and effort to make sure that happens. We want to make sure when we're thinking of understanding education that students with less formal education are going to feel like they're underprepared. One of the things that I know with our EMT program is students will come in there and it may be the first time that they are ever coming back to college, and they are on thin ice with their own abilities. They may not be. I'm lost for words on this right now, but they are not going to have the confidence that they would otherwise. Right? They may feel less entitled to ask questions because they feel intimidated, or if I ask a question, I'm going to be stupid. You got to be real careful on how you deal with that. Some folks have had lots and lots of education. Some folks have had zero education at this level. You're going to have to do what you can to try to make them feel as comfortable as you can. Marital status. It may hinder or enhance the student's commitment and obligations to the class, and cultural and ethnic groups may place a great deal of importance on the marriage, and the decisions regarding student issues may be made by family members. We do have to remember that FERPA exists, and with FERPA we're talking about situations that are private. So if I have an adult who's over 18, but they can't make decisions because it has to be made by a family member, or maybe they want information from you, they may call you or send you a message, tell me how my XYZ is doing, you can't do that. That's going to be an issue because that's their private information, but you have to get their permission to release that back, because again, each person has a right to confidentiality. Understanding income. That's a big deal right now. A couple things I think about when I think about money. The first is almost every student is broke, right? And some students are way more struggling than others. Things that I didn't know until recently. At Kellogg Community College and across the country, there is a problem with food insecurity in schools. In general, I should say, just in schools, but specifically when it's being assessed in schools, and we're finding out that people don't have food. You can't come. We talked about Maslow's hierarchy before. You can't learn if you're hungry. If you're starving and you haven't eaten, it's very difficult for you to learn. So what can we do to try to identify some of those things? Well, at KCC, we have community food baskets that are out. They've got Pop-Tarts and ramen noodles and protein bars and healthy snacks and things of that nature, right? Because so people can grab them and go. It's free. It's designed for them to be able to have something to eat. Teaching high school, those students may not eat because they absolutely have no money, or parents have no money. And so they'll come to class and they haven't had breakfast. They'll come to class in the afternoon, they haven't had lunch. I kept snacks and noodle cups and stuff available so that those guys and gals could eat, so they could have that. Another one that we think of with income has to do with hygiene. You're going to give students uniforms, great. Well, do they have the ability to buy laundry soap, deodorant, toothpaste, shaving cream, shaving razors, cleansing wipes, right? Not always can they do that. We had a lot of problems with students with hygiene issues, and regardless of of how we tried to attack it, I shouldn't say attack it, but work with the students on it, it didn't really work out the way we never seen any major progression. It was addressed for a little bit, and then people fall back into that routine. One of our instructors came up with an idea of creating hygiene bin baskets and putting them in the bathrooms here for students to use. There's a QR code. We encourage them that they're going to take something to fill out the quick survey just to let us know that they're using it, not their personal information, not who they are, nothing like that, just a matter of what they're using it. And if they continue to need more of those supplies, we can keep them restocked. And unbelievably, we spent about $300, which seems like quite a bit. We have a large program to get that into the bathrooms, and almost immediately the problem stopped. Students didn't have problems with hygiene. Students didn't have problems with body odor. Students didn't have problems with the way that their clothes looked or smelled. All those things were almost immediately rectified. Now, fast forward, Christmas break happens. We come back from break. We forgot to restock the bins. And immediately we had problems with students having body odor, problems with uniforms not being clean, problems with even our own instructional staff, some of our adjuncts instructors having the same issues. Once we restocked that again, the problem went away. So there's a level of understanding when it comes to income. If you're going to require things from your students, you're going to tell every student they have to have a specific type of laptop. You got to be able to think of how they're going to pay for that. If you're requiring certain uniform requirements or boots, do you have funding that's available to help them if they can't afford it? Are you supplying any of that information or those requirements? Those are things to think of. We don't want to discriminate based on income. Parental status. Childcare is a big one. We don't have a real good solution for childcare in the United States currently. It's very, very expensive. It's a big burden for people to work. It's a big burden for people to go to school. And if we don't have children, we won't continue to have a robust, growing society either. So there's a lot of aspects that we could talk about with this. But regardless, you're going to have to make sure that you have an understanding or a clear expectation when it comes to working with childcare, because having kids is a difficult thing. They may have to leave because their school is sending them home. That's never fun to have to do, but it is what it is. And we have to make sure that we're, again, not discriminating because of that. Appearance. Now, we got to be careful on how we talk about appearance, because appearance, you don't like the way someone's haircut looks, or you don't like a tattoo. I mean, those are older style things that oftentimes we would reference as part of this, but people are much more accepting today than they were 10 years ago, 20 years ago. I remember when I started teaching in EMS, organizations said, we will not hire you if you have tattoos, period. We will not hire you if you use nicotine, period. We're not at that place anymore. Number one, there's too big of a shortage for that. And number two, who in the heck wants to work for an organization that doesn't appreciate you for who you are? And tattoos are cool, in my opinion. So a couple things we have to recognize. Number one, it can affect one's perception of a student's commitment to the educational program and a career in healthcare. You're going to, patients, personnel, physicians, nurses, EMS crews, whoever, we are going to make assumptions, right? We have bias. We have to be aware of that implicit bias. We also have to recognize with religious convictions, right? They may impact appearance, hairstyles, wearing of certain styles of clothing. Those things are oftentimes issues we have to begin to try to identify and work around. We also need to make sure we recognize that each individual has rights, and we don't want to have those rights conflict with what our dress code is, whether it's in the clinical setting or not. I'll say this, in the clinical setting, there are very strict policies and procedures on that with the certain organizations that we have. We may set that as our highest standard, but if a student needs to go to a clinical site and they're being discriminated because of their dress from a religious or some other aspect, the clinical site should not be doing that, number one, and you should not be supporting that either. Understanding personal habits is important. Smoking, drinking, exercising can either help you or hinder you, right? Especially when you're dealing with a collegial relationship. When you are thinking about this, right? People smoke, that's fine. But if you stink like an ashtray, that's not good for someone that's got asthma, right? If you've got yourself covered in so much Axe body spray that you're going to cause someone to have even more difficulty breathing when they're in the ambulance, those are things that are an issue, right? Personal choices, ethics, morals, their convictions, all of those may prohibit some students from participating in group activities. So respect that, right? The last thing we need to do is have everybody and their brother sitting out smoking cigarettes, flicking butts, into the parking lot, all in a uniform. That's going to generally be seen poorly by others. So recognize that, right? Everyone has their own personal habits. That's okay, but there's a time and a place for those to take place. Understanding geographical locations. Obviously, students that aren't from your area may not feel welcome. I always say the first day of class is kind of like a blind date. They're nervous and you're nervous. You don't really know what you're walking into until you're in it. And we got to be able to try to do something to take that away, right? Make it a comfortable environment for them to be in. Now, with the realities of diversity, culture is not overt, right? Culture is there. It's a very powerful influencer. It may be subtle because not everybody picks up on all of it all the time, but it's still there, and it's a powerful tool. And the more we talk openly and the more we can interconnect with each other, the better understanding we're going to have, not only of ourselves and our students, but as providers as well. We're all essentially heterocentric beings, meaning that we have a great deal of value in our own culture and consider it normal, right? What we do is we consider normal. And we rarely question our own cultural identity, but we oftentimes, because we naturally assume our own rules, our own values, our own belief structures, because we think they're all correct. But we don't always do that to others. Generally speaking, we tend to judge others more negatively because they're just different. When we observe, we interpret, then we act. You can't control that. That's a natural instinct. That's where implicit bias comes in. If you're not obviously aware to it, right? If you're not actively trying to prevent bias, then you're going to naturally fall into that bucket, right? And again, it's based on our own cultural programming that we attach meaning to behaviors, right? It's that aspect that determines what is socially acceptable in that type of culture or group. We may not know when we're offending others because of that, because we operate in that bubble, the bubble of our morals, our rules, our values, our virtues, that we may oftentimes miss out on what others are seeing or interpreting from our behaviors or our actions. 50 to 90% of all communication is nonverbal. As I give you an eyeball. Pay attention to body language. It does make a difference. Facial expressions, behavior clues, right? Try not to use a lot of idioms and slang. I'm bad for that. And then do not take other people's behavior personally. As a new instructor, when a student would get upset with something, I really took it personally. I had a real hard time being able to digest that. Can't do that. You have to make sure that you take it with a grain of salt and recognize that their behavior and their personality is them. It doesn't have to influence you, but you should still, again, from a cultural aspect, be respectful of that level of diversity, as long as it's appropriate. We do walk a very fine line between understanding bias, cultural diversity, inclusion, equity, between that gray line of understanding and stereotyping. And we want to avoid stereotyping, right? Don't group your students together based on culture, based on performance, right? Try not to look at it like that. Try to look at your students not as much of a global aspect, but a granular aspect where you're treating them as individuals, as each unique individual with something special that they bring to the classroom that you cannot bring on your own. And so with that, I'll leave you with the realities of cultural diversity. And I would encourage you to continuously take time for self-reflection, introspection about how you interact with others as a provider, as an everyday person, and then even more so as an instructor. I hope this was helpful for you guys, and we'll catch you here on the next one.